Again, this is the link. Sabrina Salas Matanani. My name is Chris. Good morning. It's all proudly brought to you by First Hawaiian Bank, Calvo Enterprises, and IT&E. Charles Esteves, the Civil Defense Administrator in the KUAM News Zoom room. Some good news yesterday, Charles. Let's get some good news for a change. Help is on the way, but will it get here in time? We'll just give you the floor, Chuck, and then the announcement came out that FEMA has granted a couple of our asks, right? So we'll just give you the floor, explain what, and then Sabrina's got 20 million questions for you.
Hey, thanks. Good morning, Chris and Sabrina and Jason as well. They're in the back. So just to let you know how the request was developed was we initially had a mission assignment early on March or April, that we required DoD support for the anticipated need based off of the models at the time. And so the models, if you remember from March or April, showed that we may need at 1,200 to 3,500 beds, 500 to 1,200 as the possible best case scenario, and then possibly 480 ICU beds. And so that was around March or April, and then we're expected to peak by mid-June. But obviously, with the flattening of the curve and where we're at today in the trajectory, so we now have a new FEMA mission assignment for DoD for medical staff to come in, and this is for a period of no more than 30 days.
So when are they getting here?
Yeah, so they're deploying here, so they're probably coming on either a combination of commercial or military air, but so it's a phased approach. So phase one is 2 intensivists; those are your critical care doctors, and then we have 15 nurses and 4 respiratory therapists. And so we actually have a senior person from HHS ASPR, which is the Assistant Secretary of Preparedness for Region 9 under the Health and Human Services, John Bartletts. So he actually came in Monday night. And so he's actually been one of our advisors for the past several months this thing began. He's helped us to get our, any PPE requests, any sort of medical supplies from the federal government as well. And so what his job is to oversee the integration of DoD forces, basically the reception, staging, and onward integration with GMH and other medical professionals here.
Charles, was his Mr. Bartlett's arrival here prompted because of the severity of what's happening here, or was this just a routine? I mean,
well, correct.
Why did he come?
So the ask was prompted. The request was prompted based on the severity here, and so we've identified shortages, all the way back as early as April. But
no, I meant for Bartlett to come to Guam.
Yeah. So
because we made the ask, then they send somebody here. They send
absolutely. So he's here specifically to oversee the implementation of this mission assignment. Ensure there's no hiccups because we only have him for a period of 30 days. Right. Mm-hmm. And within that 30-day period, he's also going to assist us to develop basically a scope of work for some sort of contract support for medical support, medical personnel support.
Are these military doctors and nurses and respiratory therapists?
Yes, the mission assignment was made out to the Department of Defense.
Okay. Do we know where they're coming from? Is this all over the country?
Yeah, so we don't know the exact unit they're coming from, where they're coming from. I don't even know the branch of service at this time. Mm-hmm. But I did receive a text from one of our members of the FEMA integration team that 8 are coming in today and 7 more are coming in tomorrow.
Are these nurses, the 8 and 7, or what are they?
So we're still trying to get the breakdown on who's actually coming.
When they
say again, sorry.
When they get here, where are they going? Straight to GMH, or is there like a brief?
Yeah, so it'll depend on where the GMH, the state surgeon cell, the physician advisory group, where the need is most. So I don't know if that's going to be direct to GMH, the skilled nursing facility, but it will probably be one of the two, or any sort of facility designated by that group.
You mean like GRMC?
So I'm not sure about GRMC. I do know they're here specifically for GMH.
Okay.
So just again, so the staff that are being deployed here are the 2 intensivists, the 15 nurses, and 4 respiratory therapists, and they're going to be here for 30 days. And Mr. Bartlett is here, and he's going to assess our needs, and possibly after that 30 days, we could see more.
So we wouldn't see more, but so the needs actually already been assessed, and that's where we got this initial deployment, and the approval of the mission assignment from FEMA. So that assessment was made already. We had several data analytics calls with FEMA prior to the actual approval of the mission assignment. But what he's gonna do besides overseeing the integration of the DoD forces, he's gonna actually help us to identify next steps to prepare a contract or to assist us in working a contract for medical personnel. And only because, you know, we're literally taking these people away from other states and territories, right? So even the federal government themselves, you know, they're short on resources. So when they come here and they assess Guam's need and they basically provide us that this short-term temporary support, it's really up to the territory, up to us to kind of come up with the longer solution.
And when you say contract, do you mean contracting military personnel?
Contract more likely from the private sector.
We had
So FEMA's actually provided us a list of healthcare providers nationally that a lot of states and territories have been tapping into.
we had a couple comments. Are these personnel going to be tested or quarantined? What would the protocol be? Because they're essential, right?
Correct, and we only have 30 days, but we're not. So even like when Mr. Bartlett came over, you know, he's still on restriction of movement, right? So he still has to just go from his hotel to his facility. He still had to get tested prior to, you know, and still, you know, so everyone still has to follow the same procedures set by the public health director.
Who came up with these numbers? The 2 intensivists, 15 nurses, and the 4 respiratory therapists. Who provided those numbers?
So that was a discussion and agreement between the Cure Action Team, which is, you know, State Surgeon Cell, GMH, and also the Physician Advisory Group. And so we had a couple of calls with FEMA, and you know, basically that's how the numbers were agreed upon. You know, we basically gave our need. FEMA came back and said, "Hey, here's what we can provide. You know, and here's what we can provide on phase 1." And what I sent you earlier on phase 2 is that if need be, if we need to surge, then the mission assignment actually allows for 4 intensivists, 36 critical care nurses, and 8 respiratory therapists. So, and this includes the phase 1 resource push.
Have we asked to go the max for phase 2, considering the fact that we just heard that 5 doctors are sick and there's up to 20 possibly nurses at GMH alone?
Yeah, and I think that's what's going to be that assessment and decision is probably going to be made sometime this week. You know, and actually throughout the entire deployment of these people.
So during this time, although we're getting the phase 1 amount of help, at any point we can see more people up to this max right here, the 4 physician intensivists, the 36 critical care nurses, and the 8 respiratory therapists. Is that on top?
Absolutely.
Yeah. Okay. So, and they would be here for 30 days, within that 30 days. Okay.
Correct.
What happens after 30 days? And we
After 30
still
days,
need help, and we haven't been able to, we can't get anybody to come to Guam.
Correct. You know, that's where we have we have 30 days to basically to develop scope of work and you know, go through the procurement process to get a medical support contract.
It sounds like we should be looking yesterday.
Yeah, you know, and the thing is, you know, the assessments have already been made. You know, we know what the need is. So that, you know, and I don't know if on the GMH side, you know, if they already started looking at a medical support contract. We're here to assist and coordinate the need, right? So I think it may be the fact that we don't really know what national resources existed. You know, we know what we have on island, but if you look at a lot of the medical personnel on island, a lot of them, you know, they moonlight, right? They
Yep.
work at multiple places, and we're basically just using our resources internally. So, really thankful for FEMA for providing that list of national healthcare providers.
So, having said that, you guys know what our resources are on island. Do we have any more resources? We aside from those that are moonlighting, do we have?
Yeah, and I think that's what led to the actual improvement of the
Okay.
mission assignment for FEMA, is that we have exceeded our capacity and capabilities within the island as a territory.
Chuck, we
And,
had
I stated this before, is that the federal government, they only give us resources when we've demonstrated the need, when we've exceeded our capabilities. And so it's not an easy process of requesting. When we do this request, there's calls that need to be made. There's actual checklists. There's a bunch, basically, questionnaires, and they want to be absolutely sure that when they take these resources away from somewhere else, that they're giving it to to an actual state or territory that's in need, and we've demonstrated that
right.
based on our discussions with them.
Was there any discussion with? So you demonstrated this need, but then we had the governor write a letter to the CDC because she was triggered that the CDC had called Guam a hotspot, and she wrote a letter to the CDC. We had Lillian on the other day, and the governor's letter to the CDC was basically, "We have 5 million beds. We're totally fine here. How dare you call us a hotspot?"
We have 83.
83.
Yeah, and
Yeah.
I'm not sure, but I think that was more so for the I mean that, and I don't know. I mean, I don't know if I'm splitting hairs here, but I think when this actual mission assignment is for the lack of personnel. So I'm not sure if it's more of her letter to CDC was more of the overall risk, right?
Yeah.
Versus our total medical capability here and capacity here in Guam, right? Because we've identified that we've lacked capacity, from the start of this event. But I think that's kind of separate than the overall risk, which it's continually being assessed. It's assessed every day, right, by the Cure Action Team, GMH, State Surgeon Cell, Physician Advisory Group. And every day these numbers change based off of what information we have coming in from CDC, HHS, FEMA, and also to let you know that our numbers, back in April and March, they didn't really match what FEMA was tracking, and they have their own modeling, and so we actually came to an agreement on the modeling, kind of this happy median. And this is why we're able to get this support today, because, just a constant communication with our federal partners on, what the actual threat is and what the actual need is. But so I can't speak too much about the.
That's cool. I know. No. We had a comment here talking about the tents, right? I know we had talked to you about these tents. The comment, basically, the gist of it was typhoon season. How feasible is it to have these? Or if we're still going to be using these field medical tents.
You could put
Yeah,
them.
so the tents, I mean, they can be put up in a day and taken down in a day.
Okay.
Right. So we're not too worried about that.
All right.
And they can withstand the load of a small banana storm. But just say, even with the temporary facility that we may build out of steel or whatever, I mean, it still needs to be rated for specific typhoon conditions, right? So that's something to take into account. But we really do have a need to be able to rapidly increase. And so, as I mentioned the last interview, that the tents is one piece of this.
Right.
We have the federal medical stations as well. We have the use of the skilled nursing facility as a warm center, right? So it's a lot of different moving pieces to build up capacity. It's definitely it's definitely not easy, and I'm really thankful that everyone's doing their part.
So, have the tents arrived? The blue
They
med
have
tents?
not arrived. So we received all the quotes on Monday, and so we're just pending the actual award of the tents to a vendor.
Do we know if this vendor has the tents on island?
That I don't know, and that's something that we need to discuss. I'm not sure if they do, but I mean, I don't imagine them actually having this capability on Guam.
I wanted to
think
kind
you're
of, maybe we can get back to the field medical tents, but I wanted to ask, someone had told me, so the quarantine facilities like Dusit is one of the quarantine facilities?
Correct.
Right. And so,
Yeah, the corporate order.
correct me if I'm wrong, but I recall during the first round of the quarantine facilities, they were used as quarantine facilities, and I'm not sure if the different hotels were allowed to accept guests, who aren't being quarantined or what. So I heard that Dusit was still accepting guests for, local guests outside of the quarantine facility. Is that prudent? Is it?
Yeah, so
legal,
actually,
or-
so I had the inquiry yesterday and a second to check on, but just let you know that the Dusit Beach, the former outrigger, is the primary quarantine facility, but they have some rooms that they're renovating. And when we talk about renovations, they're really just waiting for a TV, and they just didn't feel it was right to put someone in quarantine for 14 days and not have a TV in the room. They were kind of afraid that they may go stir crazy. So, we said, hey, we do need the capacity. So they allowed the capacity over at the on the Dusit side. And when we occupy a quarantine facility, especially overflow at some place like the Dusit, it's floor by floor. And I can tell you that the staff over there, they've been really great ensuring that we have all the mitigation measures in place. And I don't think there's any issues with the current operations of the Dusit and the actual quarantine operations, but it's something we do need to find out.
Yeah, because I didn't recall at Days Inn where you had people quarantined Days Inn, but hey, I want to get a room in the second.
Remember, they had the guards.
And I-
Nobody could
Yeah,
come out.
yeah,
I think that's the difference, is because the Days Inn is isolation facility, so
right.
everyone there is COVID positive, and actually with the diversity in isolation facilities is that we have no staff from the actual facility there, so it's completely shut down to anyone besides public health staff or government Guam staff.
Well, no, but Pac Star was the quarantine facility, and there were guards there, and I don't think anybody was allowed inside there either. So you guys don't know if people are allowed to still rent rooms at Dusit?
I know they are, Chuck. I received a recording of someone reserving a room, and they're not in quarantine.
And like I said, there's when we occupy quarantine facility, it's floor by floor.
Okay.
And if we need to restrict access to those floors, we have guards on each of the floors, and so there's a lot of mitigation measures that I'm sure between the staff and the National Guard and public health that they did before they actually made that decision for overflow. I can tell you the same thing was done over at the Grand Plaza. When we're using Grand Plaza to overflow for Wyndham, we still had self-pay customers, and these are people that we didn't monitor. Self-pay customers from the Council of Palau, those on medical referral. And so they were allowed to utilize those rooms, and we utilized certain floors of the Grand Plaza. And so, there was that intermingling as well for those people that, we were monitoring on the government Guam side, and those that were required to quarantine but weren't necessarily under our watch.
So
I think, it's the same thing. If there are any any guests over at the Dusit, and just let you know that anyone coming in, right, and if they're required to get a hotel, and in their self-pay, they're still required to basically quarantine, restriction of movement if they're authorized.
Chuck, I was looking over the docs you had sent, and I mean, correct me if I'm wrong, but the math I had come up with is that for the average person in a 14-day quarantine, the cost is roughly about $3,000. Is that? Would you agree with that?
Yeah. So the outrigger, in all transparency, the outrigger price is higher, right? But there is a lot of decisions that made, a lot of cost saving decisions that were made by consolidating the quarantine facilities. An example is in the previous 3 quarantine facilities, we had total capacity of 414, right? So a lot of our costs were spent on, at certain times during, low visitor or incoming passenger arrivals is on the unoccupied rooms. And so now with this, the new agreement over at the Dusit beach is that we're only paying for 300 rooms, unoccupied, occupied, and we're also paying for additional rooms past the 300, right? So you can imagine that the previous QFAX, with capacity of 414, if we occupy 200 rooms, we're basically paying for 200 some rooms worth of basically unoccupied fees for those rooms, more of a holding fee. Additionally, after August 21st, we lost our 100% for the National Guard as well. And so after August 21st, we have to pay a 25% cost share unless we get a cost share waiver for the utilization of the National Guard under Title 32 502F. And so we estimated that the National Guard over at the 3 facilities, by consolidating to this one facility, we are saving, maybe 125, 150K, if not more. Additionally, the same thing goes with public health. And, they're them operating in 3 different facilities. And then finally, something that the Dusit Beach has, and we didn't really have this at the other facilities, is the open space to test guests prior to actually entering their rooms. So there is mass testing.
Okay. So I guess Chuck. So is it about $3,000 per quarantine traveler?
I got to do the math, but
Okay.
it's $159 a night,
Right.
Plus the meal. So
but then it's being staffed by the Guard, right? So what role does the Dusit staff play? Is it just getting blankets?
So the use of staff, of course, they're still doing the laundry, housekeeping, and the meal preparation as well. Additionally, they check on for any other needs that the Guard management team may have as well.
So I think we asked you this before. You stand by this procurement because it kind of seems like Cortec got a sweet deal.
For which one?
Well, I mean, I don't know. It just seems a little.
Oh, for the last QFAC?
The Dusit and what we're talking about now.
Yeah, and I think the thing with the emergency procurement is that we also have to take into account that when we actually request for quotes, there's still not too many facilities that one can meet the bid specs, the requirements that we put in the quote, and then 2, there's still facilities not submitting quotes or they've declined for whatever reason. And so that's another piece of the puzzle.
So you're basically saying that the consolidation of the hotels and the proximity of them being connected to each other made that bid the one?
Yeah.
Okay.
Correct. I mean, we needed a facility that we can scale up to 550 or more, right? And of all the facilities that can do that, only one, and it was really the Dusit that submitted a quote. Wow. The others either declined to submit a quote for whatever reason.
I haven't had a chance to see any of these documents yet, but you said, so 300, I know you did, but I didn't have a chance to read it. The 300 rooms at the Outrigger, that's what the contract is for?
We guarantee 300 rooms.
Are all 300 occupied?
They are, yes.
And so did we get another contract for the Dusit?
No, so the agreement is that we have the ability to scale up, and that's what makes this really different is that, we need a facility that we can scale past the 300 rooms.
So, but does the Outrigger have any additional rooms? I thought they had more than 300.
They do. So the actual Dusit Beach, former Outrigger, has 600 rooms, but there are some rooms under renovation right now, and that's really just pending new televisions.
Like 300 rooms are missing TVs?
So I don't know how many floors exactly, but they've provided us the additional capacity on the Dusit Beach side.
Are we paying more for the use of the Dusit rooms?
We are not. Yeah. So we are not paying for any unoccupied rooms past 300.
No, I'm talking about Dusitani because that's a 5-star hotel. Are we paying more for this overflow? Are we paying the same rate for the Outrigger?
We're paying the same rate. Yeah.
Okay. Well, that's good.
Yeah. Okay.
How do you guys? How is it determined who gets to stay at the Dusit? Like first class? Yep, you're going to the Dusit.
Fancier your shoes.
Or
yeah, you got fancy shoes. You're going to Dusit.
Yeah, but it's the other part, and this is very very subjective part is overall guest satisfaction, right? You know, some people,
Right, yeah.
you know, and I think I stated this in the past interview. You know, give me a bed and shower, I'm good to go. But
And a Gatorade bottle to pee in.
yeah, you know,
Yeah.
but you know, some others, you know, they just prefer that higher standard of comfort, right?
I was talking
I
to
mean, it could be like local residents. You're staying at the Outrigger. People from Japan or wherever. You're going to go to the Deuce It.
And we're gonna
I'm just
massage
wanna
your
make
shoulders
Sure, like
through a trash
how are you
bag.
guys deciding?
Yeah.
But
Yeah, no,
anyway.
I was talking to a friend in Hawaii, and like they don't have a quarantine thing. I think the travelers there pay for it out of pocket.
Yeah, well, there are. I mean, there are self-pay customers. You know, and some, you know, for example, some of the contractors that come, the DoD contractors that come here, some of them have been self-pay customers. The Plow, I know the Plow consulate in the beginning, they had self-pay customers as well, medical referrals, and so you know, it's you know, the quarantine operation needs to continue for as long as we can.
So,
Right. I mean, it's to date, it's been one of our you know, most effective mitigation measures at catching people from off island that may be positive.
So, but right now, this is it. This is all we have for the consolidated quarantine facility, the Deuce It and the Outrigger. There's no other RFQ, RFI, RFP, or anything else out there for another quarantine facility.
This is it. This is the solution.
Okay. What about a consolidated isolation facility? I know there were talks about that.
Correct. So that's something that we're currently working on right now. So let's let you know the consolidated isolation facility is over at the Bayview right now under Cortec. And but the long-term goal is to actually have a consolidated isolation facility / alternate care facility. And when we say alternate care facility, it's basically you know, the use of those federal medical stations that we talked about, those beds, and you know, and putting them in a ballroom. That way, if someone that is asymptomatic in these isolation facilities should develop symptoms, we don't have to move them, you know, to GMH or SNF or whatever facility they're designated to go at, and just move, you know, downstairs to this alternate care facility and be monitored from there.
So like
So
a hotel, and then put the beds in the ballroom kind of thing. Is that what we're talking about?
Yes. Yeah, and that's more of a you know, long-term planning, long-term goal is to have a isolation facility / alternate care facility.
Yeah.
And you know, that's what the Army Corps of Engineers came in and worked with us, you know, in the beginning, is to basically, you know, assess these alternate care facilities. Right. So they assessed hotels, they assessed gyms, a lot of congregate shelters, the University of Guam Field House, and so there's, you know, there's a lot of decisions that need to be made when actually activating an ACF.
So where are we looking at? Like Fiesta? What?
So I think it depends. You know, one, we have to you know, develop the scope of work, and so we have the initial scope of work for an ACF, but you know, two, just working through the procurement process as well.
And
so we're not actually sure where the consolidated ISOFAC / ACF may be.
Right, but the Army Corps of Engineers was here and they did an assessment. So what were the areas that were likely to be these alternate care facilities?
So the
I mean,
two
aside from
primary
UOG, because if you're going to consolidate an isolation facility, you would still need the room. So you would probably rule out the field house.
Was the Sheraton and the Hilton, but on the other side of that is, you know, we basically would have to work with the vendors to see if it's something that they even want to consider, right? Do they want to turn their hotel into an isolation facility? So, you know, we did assessment when we originally did the assessment, you know, it was just as an ACF, right? So that was just the utilization of their ballroom and not necessarily their hotel rooms. But, you know, as, you know, fast forward to today, it's the consolidated ISOFAC / ACF as, you know, as the way to go. And so that kind of changes the dynamics of what, you know, original assessments back in March and April.
Okay. Well, I mean, hopefully we could probably lock this in and lock this down soon, so we're not in the situation where we are today.
Scrambling, yeah.
So, yeah.
Thanks,
you
Chuck.
know, for sure. Yeah.
You good, Bree?
I mean, I could keep going, but
I know you could.
We're good.
Yeah, yeah. We'll get you back on, Chuck.
Wait, was there anything else going on that we need to know about?
I love this question.
So I think you got quarantine facilities, isolation facilities,
Tents.
the emergency medical shelters, the FEMA mission assignment. Just to let you know, we're still also continuing to do the non-congregate shelter for the homeless as well. And so our current population is 74 over at the global dorm in Mighty, and so that's still ongoing. Other than that, just continuing to support by coordinating the resources that Governor Guam medical professionals need. So,
All right.
Thanks, Chuck.
Charles.
no worries. Also, want to do a shout out to Leo Espia. So he's a valuable member of our team, and today's his birthday.
All
Right
right.
on. Happy birthday, Leo.
Happy birthday.
Sorry COVID took your birthday.
Yeah.
It's taken mine too, Charles. It's taken mine. I haven't even had it yet, but yeah, it's a casualty of COVID. Thanks, Charles.
Hey, thank you very much
Yeah.
for everything you do.
Okay.
You too.
Wash your hands, stay home, unless you're working. Yeah, I mean, it sounds kind of silly complaining about a birthday loss and people are losing their lives. 8:30, let's keep it in the KUAM News. The Zoom room, as we're really in danger of getting backed up here. We have Lillian Posadas from the Guam Memorial Hospital coming up. So we'll go right to Superintendent of Education.